take his medications, and I will see him next time he is in the office. Yeah, I gotta go. Okay, bye. Mary, please come in.
Thank you.
So, I see since our last appointment that you've been on this dose of medication for about 6 months now?
Yes.
Okay. And are you taking it every day?
Yes, I am.
Okay. How are your voices?
I still have some voices.
Are they telling you to hurt yourself or hurt others?
No.
Are you sleeping well?
I think so.
Are you staying up too much? Are you sleeping too little? Are you sleeping too much?
I don't think so.
I noticed that you've gained some weight. What are you eating?
Well, I try not to eat between meals, but this medication makes me so hungry. I want to go off of it, can I?
Mary, it is better to be fat and functional than crazy. I don't really think you want to stop this medication. You could end up back in a hospital. Hello. Oh, yeah, okay. No, we're on for lunch. I'll see you in a minute. Bye-bye. So I think things are going well.
Well,
Why
actually...
don't we reschedule an appointment for 3 months? And I will see you then.
Thank you.
Okay.
Hi, Mom.
Hi, Mary. How was your appointment?
I don't like my medication. It gives me all these side effects. I saw Sarah the other day. She asked me if I was chewing gum. I wasn't chewing gum. I didn't have anything in my mouth. I wonder if that could be a side effect of this medication. You know, I'm fat.
Oh, Mary, you're not fat. You sound really frustrated. So why don't you tell me what happened?
Dr. Smith doesn't listen to me. I can barely get a word in edgewise. All he says is, do you still hear voices? Are you suicidal?
Well, those are really good questions. However, does he ever have inquiries about muscle stiffness or dizziness and maybe weight gain?
He didn't say. You know, Mom, I'm embarrassed to admit this, but I'm not having a regular period.
Did you tell him about that?
No, he barely even looks at me. He doesn't give me a chance. Mom, what do you think about me going off this medication?
Oh, Mary, I know you feel like you're having side effects. I just don't want you to get worse again. So, you know, why don't we get organized? I have an idea. Let's make a list and we'll take it to Dr. Smith at your next appointment. And you can talk about your meds and your options. And you know, if you need me, I'm available.
Thanks, Mom. Okay. Well, first there's the weight gain. Then I'm a little bit tired all the time. I sleep 12 hours and I wake up hungry. And then I'm not having a regular period. It's been over 2 months. Is that normal?
We will ask.
And I still hear these voices bothering me, though they are better than they were when I wasn't on anything. I don't think I could ever attend a college class while the voices are bugging me. I don't think I could even focus enough to work a simple job. Then there's that thing with my mouth. You know, Sarah asked me if I was chewing gum when I wasn't. I wonder if that could be a side effect from my medication. I think that's new. Do you notice it?
I don't notice anything, but if it's bothering you, we definitely need to bring it up at your next appointment. Oh, Mary, I'm so proud of you. I really am. And I have an idea. Why don't we take this list and make an appointment before your 3-month appointment?
Okay.
And if you like, I can go with you.
Thanks, Mom.
You're welcome.
I'm sorry. He's just gonna have to take his medication. Yeah. Hi. My patient just got here with her mother, so I will call you back. Hi, Mary.
Hi,
It's
Dr.
good to see
Smith.
you. How are you doing?
I'm doing okay.
So, why are you here early today?
Mary had some concerns about her meds and some side effects she's experiencing.
Okay. Are the voices getting worse? Are they telling you to hurt yourself?
No, but they're distracting me. I can't think straight. I can't function.
What is it that you can't do?
What do I wish I could do? I wish I could go back to school again or work a regular job. I used to volunteer at the elementary school, and I can't even do that anymore.
Mary, not everybody with schizophrenia is able to work or return to school, but many can. Our personal goal for you, I think, should be to help you function as well as possible.
But she does have all these side effects.
So, talk to me about the side effects that you're having.
Well, I can't stop eating.
Okay, so we can talk about a plan for diet and exercise first. If we see that that's not having an effect, there are medications we can discuss that would help with weight gain.
I'm a little tired all the time.
And that's another common side effect of the medication that you're taking, although if need be, there are medications that can help with that as well.
I haven't had a period in over 2 months. I'm sorry, I should have mentioned that before.
Yeah, that's okay. Antipsychotic medications can cause irregular periods.
Is it serious?
It's a well-known side effect. It's not serious in terms of long-term health consequences.
And I'm still hearing these distracting, terrible voices.
Ultimately, I think we should probably try a new antipsychotic medication. But before we get into that, is there anything else bothering you today?
I met with a friend recently. She asked me if I was chewing gum. I wasn't chewing gum. I didn't have anything in my mouth. Is there any possibility that that could be from this medication?
Okay. Yeah. So I see this now that you mention it, and I'm sorry that I didn't catch it earlier. The movements in your mouth are consistent with what's called tardive dyskinesia.
What's that?
So tardive dyskinesia is an involuntary movement disorder. It can be caused by the antipsychotic medications, although switching medications doesn't necessarily help it get better. Fortunately, there are some new medications that have come out to treat the symptoms of tardive dyskinesia.
Good.
Why don't we head to the exam room next door to take a look at those symptoms before we go any further? Okay. So first, I'm going to write a prescription for the new medication that we discussed, and we'll overlap it with your current antipsychotic for about 2 weeks.
Okay.
Before we do anything or add anything to address weight gain or sedation, I'd like to give this new medication some time to see how things pan out.
Okay.
As for the tardive dyskinesia, I do have to do some paperwork in order to get that medication approved. But when you come back next time, I should have that done, and we can discuss that further then.
Good. Thank you.
Mary, it's really good talking to you.
Thank you, Dr. Smith.
Please, next time, bring a list. Bring your mother.
I will.
These are helpful.
So do you think she'll be able to go to school or work again?
Yeah, so I think the important thing is to not lower your expectations. Hopefully, on a new medication, the voices will be better, and she'll be less sedated and better able to function in general.
So there is hope. I might actually get my life back.
Absolutely, absolutely. In fact, we have a clinical psychologist here who has a cognitive remediation program, which can help you regain your mental acuity in a process towards getting back into school or volunteering or working.
Excellent. Thank you.
Thank you for listening to us.
My pleasure.